So, hello everyone. Today we are going to talk about three important trials in prostate cancer. We are going to focus on the Stampede trial first, and then we are going to pick up the CHAARTED and the LATTITUDE trials, and we are going to compare them with the Stampede arms. And it's important that we study them together. If we don't, it's very confusing. So, we are going to start with the Stampede trial first. So, when we talk about the Stampede trial, see, it's if we keep talking on Stampede, we can talk for an hour, and our whole purpose is to keep it very simple and very brief. So, to understand the Stampede trial, the first thing is it's a multi-stage trial and a multi-arm trial. So, there are multiple arms in Stampede trials, and this is really very difficult to remember. Okay, so there are it initially when it started recruiting the patients in 2005, there were six arms. Okay, that was A to F. Okay, and different component, different drugs, different chemo, and different things were compared to the standard of care. The standard of care was considered to be a ADT. So what we will understand slowly, we will try to build up the concept and take it further. Okay, first we have to remember these arms, otherwise we can't recall it later on when we discuss the results. To remember the arms, the arm A is for ADT. Okay, it's easy to remember it that way. A is for ADT. Arm B is for bisphosphonates. B is for bisphosphonates. Okay, that is zoledronate. So they compared ADT plus zoledronate, that is bisphosphonates in arm B. Arm C is for chemotherapy. C for chemotherapy, and the most common is docetaxel. Okay, so we remember the group of the drugs, and that way we can remember why which arm contains which comparison. Okay, so randomization becomes easy once we understand which arm contains what is the content of each arm. So docetaxel was in arm C because C for chemotherapy. Arm D mainly includes, to remember, diclofenac group of drugs, that is celecoxib. Okay, NSAIDs. So arm D contains the diclofenac group of drugs, that is NSAIDs, that is a celecoxib. Arm E contains E equals to A plus B plus C, okay? And arm F contains A plus B plus D. If you can just remember it this way, this will help you to understand how the trial started. Again, just quickly to recall, A for ADT, B for bisphosphonate, C for chemo, that is docetaxel, D for diclofenac group of drugs, that is celecoxib. E is ABC and F is for ABD. Let us understand so far this much. The trial started with this much of arms, and later on for certain arms were added. We will go on to that subsequently after we understand what happened to this first six arms. Okay, so the first result of these arms were published in so before we move on to the results, okay, we need to understand the inclusion criteria. So if we are under the impression that the Stampede is mainly for the metastatic CA prostate, then it is wrong. It not only included the metastatic CA prostate, the Stampede also included the non-metastatic CA prostate, that is locally advanced disease, that is T3, T4 disease, were also included into the Stampede trial. And even in relapse cases were also included into the Stampede. Okay, so Stampede stands for systemic therapy in advancing and metastatic CA prostate. So in advancing and metastatic, so this indicates that it not only indicates a metastatic, includes a metastatic CA prostate, it also included non-metastatic CA prostate, the locally advanced cases. Okay, now the first result which we were talking about was published on the arm D. Okay, so this was the arm D, celecoxib, diclofenac group of drugs. So what we got from this arm is basically it was published in 2012. Started in 2005 recruitment, and it continued till 2012 when the published data in the Lancet. What did it say? It said that now something we need to understand regarding the arm D. Okay, now what did the RMD said? The result published was insufficient. So they said that celecoxib is insufficiently active in prostate cancer when it was not recommended after that. And not only that, even the recruitment was stopped after that. So arm D was stopped after 2012. We don't find any data on arm D after that. There were no patients recruited to the celecoxib arm. Now, not only arm D was stopped, we already know that arm F also contained celecoxib. Okay, we know that arm F was ABD. Okay, so since it also contained the celecoxib, therefore arm, so as per the trial website, they say the recruitment was also stopped to the celecoxib arm in the arm F. Okay, the reason was, and so even because the celecoxib is going to make the result all biased, and so even the arm F recruitment stopped. If you look at this, the only thing in this slide that you need to focus is arm D recruitment was stopped in 2012 after this publication in Lancet. Not only arm D, even arm F recruitment was stopped because it also contains celecoxib, and the results of arm F were never revealed. We could not find the results of the arm F. Becomes easy for us. We just need to follow the remaining arms now. For the first, to try to make it very clear, now we move forward to the remaining arms. Okay, every time try to recall the arms. A is for ADT, B is for bisphosphonates, C is for docetaxel chemotherapy, and D and F we don't have to discuss anymore now. Okay, and the arm E contains docetaxel plus zoledronate, that is ABC. Okay, now let us understand what was the next outcome. The next outcome, which was published, was in 2016, again in the Lancet. And this time they have clarified the outcomes of arm B. That is, we know what happened to the bisphosphonates, and we know about the other thing which contained this, that is arm C. We had the data of arm C, that is chemotherapy arm, as well as the combination of B and C and A, that was arm E. Okay, that is A, B, and C. So if we make it very simple, the whole interpretation of this comparison has been that zoledronate has no evidence of any improving survival in prostate cancer group. So zoledronate is not recommended. If you combine zoledronate with the docetaxel, the survival was equal to just uh, docetaxel. Okay, that is arm C. So arm C versus arm E, it was found that arm C had equal survival compared to arm E. Therefore, based on all these calculations and recommendations were made that zoledronate should not be an evidence. There is no should not be a standard of care. Only for bone health is it recommended. It has no role in prostate cancer. Okay, so docetaxel after this publication started becoming the standard of care. Why? Because it significantly improved the overall survival. So just quickly to come, what was the primary objective of the Stampede trial was overall survival. Okay, that was the primary objective. And docetaxel, when added to ADT, improved the overall survival significantly from 71 months to 81 months. Okay, so after this 2016, it started becoming the standard of care, ADT with the docetaxel. Okay, so if we quickly sum up and try to understand the milestones, 2005, the recruitment started for Stampede trial. It was a multi-arm, multi-stage trial. So arm A is ADT, arm B is bisphosphonates, arm C is chemotherapy, that is docetaxel, arm D is diclofenac group of drugs, that is celecoxib, arm E is ABC, arm F is ABD. Okay, so if we just quickly come, bisphosphonates not recommended, zoledronate is not recommended based on the publication in Lancet in 2016. Chemotherapy docetaxel, yes, it's recommended. It has become the standard of care after 2016 because of its improving the overall survival from 71 to 81 months. What about the arm D? Because it also contains celecoxib, it was also stopped in, it was stopped, okay? It was stopped in 2012. And not only arm D, since arm F also contains celecoxib, even this was stopped in 2012. Okay, the first results were on celecoxib arm, which were stopped after 2012. Okay, what about the arm E? Since it contains the docetaxel, along with zoledronate, they have found zoledronate need not to be added to docetaxel. So arm C has been found to be the most superior and the most beneficial out of all the arms in the first set of results, okay, in 2016. Now, During this, while we are discussing all this, there has been other arms which were started in 2012. Okay, so there were other arms started around 2012, 2011, and these we have to understand. Okay, so arm G started and it included abiraterone. Arm H included radiotherapy. There is no arm I in Stampede. Okay, arm J included abiraterone plus enzalutamide. You can remember it as JAZ. That is abiraterone plus enzalutamide. Okay, that is in arm J. Arm K and L started very late and it started around 2017, which included metformin and transdermal estrogen. We are coming to KLN later on. Let's understand G, H, and J. Okay, let's understand G, H, and J. It's very, very important. So the results of arm G, that is the abiraterone group, was published in 2017 in the NEJM. Now, what does it say? Now, this is the arm G. You can remember it for the timing. Try to just remember it as gratitude. There is a reason why we are calling it gratitude. Okay, I will come to it later on. For the time being, just remember arm G is abiraterone acetate, and that is gratitude. Now, why? What was the finding of this arm? It said that if you add an abiraterone to an ADT, it improved there was a significant improvement in the overall survival, and the whole discussion on Stampede is on overall survival only because that was the primary objective of Stampede. Okay, the rest secondary objectives, the failure free survival and all the other secondary objectives, you can go through the literature and read as much as possible, but that's a whole lot of discussion. To keep it very basic, there was a significant improvement in overall survival of around 37%. There was difference between the ADT or ADT plus an abiraterone. Okay, so this is the reason why this abiraterone has been now significantly recommended after this result of the Stampede arm G. Now let us talk about this arm H. Okay, we need to understand about the radiotherapy. Okay, which was in arm H. So radiotherapy, it is now as a whole. If you consider radiotherapy, for it was not beneficial. But if you consider only a subgroup of the patients like a oligometastatic or a low volume metastatic, this subgroup analysis of the Stampede has found radiotherapy to be useful for the treatment of the primary tumor in a low volume mets. So Stampede included non-metastatic, metastatic, and even recurrent tumors. But the subgroup analysis determined that it was only the radiotherapy to the primary tumor in small volume metastasis was significant. Otherwise, there was no significant benefit. So you should know the result of radiotherapy arm, which was published in 2018. Okay, we got this result in Lancet in 2018. And based on this result, radiotherapy to the primary tumor only in an oligometastatic setting was recommended. In a low volume, in a low metastatic burden was recommended. So we are done with the arm G, that is the abiraterone, and arm H, which is the radiotherapy. Now we are left with another arm, that is the arm J, JAZ. Okay, so we are considered about JAZ, which was abiraterone with an enzalutamide. Does it help? Does adding abiraterone to an enzalutamide helps? What does the arm J result of the Stampede indicates? So if we discussed about the outcomes and published in Lancet 22, the concurrent admission, concurrent concrete administration of abiraterone with an enzalutamide is not going to help. Okay, it does not add to the metastasis-free survival or the overall survival, and that is the reason why it does not recommend. And even we in our practice nowadays, the latest guidelines CAU based on this doesn't recommend adding both an abiraterone or an enzalutamide together in a patient with a CA prostate, metastatic CA prostate. So to keep it very simple, even the arm J did not, the conclusion of the arm J was don't add concurrently abiraterone with an enzalutamide because the results of abiraterone with an enzalutamide arm was equivalent to the results in the abiraterone arm alone. So remember this for the time being. This is going to help you if you remember it this way. This is very difficult to remember if you don't have some alphabetical clues to connect them together. Now we are done with the arm J. Okay, so that was the last publication that we had. The list, that is the arm K metformin, the recruitment is still ongoing. Even regarding the arm L, that is the transdermal estrogen, well, the recruitment is, we are expecting the data by the end of 2024. But the only advantage about the transdermal estrogen that is expected is the uh, better side effect profile. Okay, we don't expect much side effects in a transdermal estrogen. The oncological efficacy comparing the transdermal estrogen to the standard LHRH agonist is still to be determined. We don't have that data yet. We are expecting that to come out, the Stampede results of the ARM KNL soon. Okay, so having understood this, okay, so we have understood the arms of the Stampede. Okay, what were the different arms of the Stampede? A for ADT. Again, I'll just quickly go back for a second. So we just quickly recall the arms: A for ADT, B for bisphosphonate, C for chemotherapy, D for diclofenac, that is celecoxib. So we know the result of the first six group. The beneficial was only ADT plus chemotherapy, that is docetaxel, and we found that the overall survival improved from 71 to 81. That is around 10 months improvement in the overall survival. Great. We move to the arm G, that is abiraterone. We remember the gratitude. Okay, so they found that if you combine an ADT with an abiraterone, the overall survival improved by 37%. And what about the radiotherapy? Only for an oligometastatic disease. What about the combination of all the three? That is arm J. Jazz is not recommended. K and L, we don't have the data. I is doesn't exist. Now, does it finish the discussion? No, we still have to go on for next 2 to 3 minutes. Let us try to implement whatever we have discussed with our knowledge on CHAARTED and the LATTITUDE trials. So this is the CHAARTED trial, okay, which was published in CHAARTED trial was published in NEJM in 2015, and this is the LATTITUDE trial, which was published in again NEJM in 2017. So this is really important for you to compare the CHAARTED. We are not going to compare each of them. Okay, compare CHAARTED with LATTITUDE. There is no comparison between these two. What you have to do is compare the CHAARTED with the Stampede, compare the LATTITUDE with the Stampede. Now, how do you compare them? Now, what was the CHAARTED trial? It was a chemohormonal study. So always, whenever you study the Stampede arm C, again C for chemo, C for this was the arm C of the Stampede. What was the CHAARTED trial? The CHAARTED trial was exactly of C of the Stampede. The CHAARTED trial also compared the ADT with the docetaxel. Now, then, what is the difference between the two? The Stampede arm C versus a CHAARTED. What is the difference? The difference is in the inclusion criteria itself, that the Stampede trial included M0, M1, and also recurrent diseases. CHAARTED only included M1, and they divided into a low volume and a high volume disease, and we are very much aware of those criteria of metastatic CA prostate, low volume and a high volume. For a high volume, preferably ADT with a docetaxel. Now, if we move on to the outcomes of these two trials, if we compare them, we are aware of this median overall survival in the Stampede arm C. Then how is it different from the CHAARTED? Why is the survival in CHAARTED so less? From 44 to 57.6, that is the overall survival, though increase was 10 months here, and here was 13.6 months. The striking difference in the so low overall survival in the CHAARTED is, again, if we go back to the inclusion criteria, Stampede had non-metastatic patients, and that is the reason why they have a better overall survival rates compared to the CHAARTED, which only included metastatic patients. So this is something you should remember it very clearly when you counsel a patient for a docetaxel chemotherapy with an ADT for a metastatic CA prostate. The overall survival that you need to explain is around 13 to 14 months of overall survival, and this is exactly what the arm C subgroup analysis, Stampede arm C says, and even what the CHAARTED trial says. So both the trial, standard trials, and they both of them are saying this is the overall improvement in the survival. Now, try to compare Stampede arm G with the LATTITUDE trial. What was Stampede arm G? Again, if you remember, gratitude. Okay. Now you try to understand why we call it gratitude. We call it gratitude because we have to later on compare it with the LATTITUDE trial. Okay. A is for abiraterone, And you need to understand that the Stampede arm G, which included abiraterone, and latitude, which is again including abiraterone. So the exactly the same thing. The only thing is the latitude only included metastatic patients. The results were exact mirror image. Okay, the results were exact mirror image, and we have already discussed about this 37% improvement in the overall survival, and so metastatic prostate cancer survival is 83 versus 76. So you need to understand the latitude is the same as uh, Stampede arm G. Okay, so Stampede arm G was ADT plus abiraterone, and latitude is also the same. So always try to read them together, try to keep them together. So these are all the results of this Stampede. If you grossly want to compile them together and want to compare with the charted and the latitude, you can go through the literature, the individual studies, and find out the limitations and there are multiple other things which I have not covered, and it's not possible to talk on all the three trials in detail. It's not technically possible. So you can go through them and hope this basic summary is useful when you go through the details of the trial. Thank you so much.